Good morning, all of you. Today I am going to Good morning, all of you. Today I am going to deal with the basic surgical orthopedic instruments, and these instruments you will come across in general surgery also. Uh, we will go through these instruments. Basic surgical instruments categorized into the following groups: forceps, scissors, retractors, and periosteal elevators, rongers, nerve hooks, curates, and dissectors and probes. Forceps and forceps, it has five basic parts and two blades connected at the joint. This is box type of joint, and it has two shafts with locking mechanism, ratchet, and finger bows. These are the five basic parts of the instrument. Any instrument. And first instrument is Chetil's forceps. Chetil's forceps, it has curved metallic, heavy metallic curved blades, and it is curved. It looks like it resembles the beak of a bird, chetil. So the name is Chetil's forceps. Okay, Chetil's forceps, and it has joint and two shafts without locking mechanism. There are two instruments and without locking mechanism, and one of them is Chetil's forceps. And where it is used to pick the sterile instruments and drapes to avoid touching from the sterile bin or sterile drum in the ward and in operation theater also. In a dressing trolley, you will see it in a transparent glass bottle filled with Savlon. Okay, and it is also used for transferring drapes or any sterile instruments or things from one tray to another. Sponge forceps. These are used to hold the gauze. These are used to hold the gauze sponge to mop up the clinic site, and it has two blades with oval oval fenestrations, and the inner side is serrated to provide the grip, and it has also locking mechanism and finger bows. So you can identify this instrument by recognizing the oval fenestration at the tip of the blade and serrations on the inner surface. And these are the toothed forceps, single toothed single toothed on one side, and which fits into the two teeth on the other side. These are available in as 1 into 2 or 2 into 3 or 3 into 4 forceps based on the number of tooth, used to hold the tough structures like skin while suturing, and used to hold scalp while scalp suturing. They are plain forceps, and they are gently used to gently move the tissues out of the way during the exploratory laparotomy. It has uh, in the middle, it has serrations over the middle piece to hold to provide grip to the thumb, and the inner surface is serrated, but it is not toothed. So plain thumb forceps used to insert packing into or remove objects from deep cavities, like while nose packing into the nose in hemostasis, nose bleeding cases, and use it to hold delicate visceral organs, and use it to hold blood vessels and nerves while dissecting. This is Brown Edson forceps, and it is short one, used for holding and manipulating the delicate tissues. These forceps have wide, flat thumb grasp area, which provides grip to the thumb, and the tip is serrated. Adds in tissue forceps. It is similar to Brown Addison tissue forceps, but the tip is toothed and used for holding dressing materials such as cotton and gauze during surgical procedures, changing dressings, and packing wounds. They have a wide thumb grasp for increased precision and control. Artery forceps or hemostats. These are available in three sizes: small, medium, and large. And small artery forceps is also known as mosquito forceps, and medium is Spencerville, larger is Bailey forceps. They are used for suturing, catch hold of bleeding points, and these may be straight or curved types. Curved mosquito hemostat used to hold the delicate tissue and used to compress bleeding vessels. Jaws are fully serrated. See, the inner surface of the blade is serrated. Blade is serrated. While applying curved hemostatic forceps to capture bleeding vessels, prefer to have your hand supinated, and with curved forceps have the convexity down and ensure the tips just project beyond the vessel. This is Kocher hemostatic forceps with tooth and transverse serrations. And these can be straight or curved, used to hold meniscus during meniscectomy. Can be straight or curved, used to hold meniscus during meniscectomy. Alice tissue forceps. It has two flat blades with multiple tooths at the tip and a joint type of box type of joint and two shafts. It has a ratchet for locking and used to hold the skin while raising the skin flaps. Babcock's forceps is used to hold the delicate tissues like bowels and appendix during appendectomy and used to hold delicate visceral organs. These are less traumatic. This one you can identify by recognizing the tip of the blades, and the tip is also fenestrated and curved. Leahy's right angle forceps used to pass ligatures around the nerves or tendons. See, the tip of the blade is bent at 90 degrees and is serrated on the inner surface. Lister's sinus forceps, you might have read in general surgery also, prevents So this is Lister sinus forceps. It prevents permanent damage to the neurovascular bundle, used for incision and drainage of abscess by Hilton's method. And you read Hilton's method of drainage of abscess from general surgery. And see, it is another instrument, Lister sinus forceps, which does not have locking mechanism. You can see here, and the inner surface of the forceps is serrated only at the tip. Excuse me. Listers versus mosquito forceps. For mosquito forceps, you will find locking mechanism, and there is no locking mechanism or ratchet for Lister's forceps, and the tip, serrations are present only on the inner surface of the tip, and here it is the serrations are present along the entire surface of the inner blade. Pointed reduction forceps are available in two sizes, small and large, ideal to grip and manipulate large bone fragments. They are the pointed reduction forces. They are speed lock bone reduction forces. This picture we have seen in the already seen in the last class. Here the blades are curved and the inner surface is serrated to prevent slippage of the bone, and there is locking mechanism in the shaft. This is the needle holder. Mm, you can identify this by seeing the blade lengths and the joint length. Joint is of box type, and the joint length and blade lengths are same, and the inner surface of the blades are serrated, and there is a groove at the middle to hold the needle in that groove and prevent slippage. See here, serrations also crisscross serrations are present, and the length of the blade is equal to length of the box joint. This is Mayo Hager needle blade, needle holder. This is towel clamp. Towel clamps are available in two types. They are Mayer's towel clamps and Buckhurst towel clamps. These are of Buckhurst type, and these are these adds weight to the drapes and towels to ensure they are staying in place, so that the drapes and towels are not slipped in between the surgeries, and it allows adequate exposure of the operative site. Buckhurst towel clamps. See. In Mayos, there is no locking mechanism, and there is no finger bows in Mayos type. This is BP handle, Bod Parker handle. They are available in 10, 11, 12, and 15, 15 size blades 10, 11, and 12, and 10, 11, 12, and 15 blades fit in BP handle 3, and 18, 19, 20, 21, 22, 23, and 24 fit in BP handle 4. So there are BP handle is available in two sizes, number 3 and number 4, and 3 are for 10, 11, 12, 13, 10, 11, 12, and 15 size blades, and 4 number BP handle is for 18, 19, 20, 21, 22, 23, and 24. They are the scalpel blades, and these are important for NEET exam also. They will give the picture and ask you to identify the size of the blade. This is 11 size blade, this is 15 size, this is 10 or 20 size blade. Okay, these are used for draining the abscess and performing a shave biopsy, and number 15 blade is used for performing a biopsy or making incisions, small incisions that are less than 5 centimeters, and any incisions on the face. Making incisions longer than 5 centimeters, debriding the wounds. Hold the scalpel for making a long, smooth incision. Draw the belly of the knife, not the point, from your non-dominant to your dominant side. If you are cutting along a sagittal plane, cut from far to near. Okay, they are the basic principles while giving incision. Hold the scalpel. For making a long smooth incision, we have to incise with the belly of the knife, not with the tip. Next, scissors. Sharp scissors. They are used to cut and dissect tissue. Both blade tips are sharp, so these are called sharp scissors. These are the tips, and both the tips of the both the blades are sharp. And blunt or blunt scissors, both blade tips are blunt. These can be curved or straight. Mayo dissecting scissors. This one is Mayo, which is a short and stout one, and this one is Megenbaum scissors. These are a long and slim and sleek one, with blade size. Blades are shorter and shaft size is longer. See, Mayo scissors have semi-blunt ends, a feature that distinguishes them from most of the other surgical scissors. Semi-blunt ends, Mayo scissors. And straight bladed Mayo scissors are designed for cutting body tissues near to the surface of the wound, and curved bladed are for deeper penetration into the wound than the type with the straight blades. See, basically scissors are of two types: so Mayo scissors and Megenbaum scissors. Mayos are Mayo scissors are semi-blunt, and Mayo scissors are of two types: straight bladed and curved bladed. Straight bladed are for superficial dissection and super cutting the superficial structures, and curved bladed Mayo scissors allow deeper penetration into the wound than the type with straight blades. The curved style of Mayo scissor is used to cut thick tissues such as those found in uterus and muscles, breast, and foot. Megenbaum scissors are surgical scissors designed for cutting delicate tissues. See, Megenbaum are for cutting delicate tissues. These have relatively long shank to blade ratio, as you have already discussed, and blades can be curved or straight, and the blade tips are usually blunt. See this one. This one is Megenbaum and long shaft to blade ratio, and used to cut delicate structures. Delicate structures. Tips are of blunt. Here it is little bit Mayer's one is stout, available in straight and curved types, and tips are of semi-blunt. Litor suture cutting scissors. They are used for cutting sutures while suture removal. This is another type one, head suture cutting scissors. This is straight one and this is curved one. The tip is here curved one, but the blade and shafts are straight. Here the blade and shafts are also curved. That is head suture cutting scissors. Sharp or blunt scissors. Tip of one blade is sharp and tip of another blade is blunt. Used to cut and dissect fascia and muscles, and one blunt tip and one sharp tip. Suture scissors or blunt scissors. Lister bandage scissors. They are used to cut bandages and remove bandages and dressings. And probe tip is blunt and inserted under the bandages with relative safety, so that you don't hurt the underlying skin. Retractors. They are of two types: a self-retaining type and handheld type. And self-retaining retractors are Whitliner, Adsons, Derico, and Mollison type, and Chanlis type. The type of retractor depends upon the depth of the incision. Initially, Whitliner retractors offer uh, different lengths for retraction of the skin and muscle are used. As the wound deepens and lengthens, the Derico retractor and Adson cerebellar, this one, Derico and Adson cerebellar retractor may be used. For superficial incision, Whitliner self-retaining retractor, and for deeper and longer incisions, we'll use Adson and Derico's retractors. Whitliner self-retaining retractors. See, the length is 5.5 inch length, and 3 into 4 blunt prongs are, we can see this in picture, and prong depth also 18 millimeters. Derico retractor is longer to accommodate a longer incision. Derico retractor is longer to accommodate the longer incision. AdSense retractor, the length is 13 inches and 4 into 5 blunt prongs can be seen at the tip of the blades, and prong depth is also 3.2 centimeters, and it has jointed arms. See, see these are jointed arms and blunt prongs 4 to 5, and here it is the locking mechanism for self-retaining. Mollison self-retaining retractor. They are used for a hemilaminectomy and 14 length is of 5.5 inches and 3 into 4 prongs, blunt prongs. Prong depth is 18 millimeter. Also be known as the initial incision retractor. Chanless retractor which you use in total hemiarthroplasty and hemiarthroplasty of hip. Chanless is a self-retaining retractor most commonly used during arthroplasty of the hip, and it is used when initial incisions are made and maintain the exposure of the hip area so that the surgeon has an unobstructed view. These are the blades, and it will have two blades, one small one, this one is small blade, and this one is long blade. First we will fix this one, smaller side, and which is anterior side, and then we will put the longer blade and adjust the and retract the tissues by adjusting the holes. Longer blade, see, this longer blade will be on posterior side. Handheld retractors commonly used when obtaining bone from the iliac crest for bone fusion in the spine cases, and these are of six types: and Army Navy retractor, Meyerding retractor, Taylor retractor, Langenbach retractor, which is most commonly used in surgeries, and Workman's cat's paw retractor for fine surgeries, and the Serenis retractor. See, Army Navy retractor. This one is manual and used to retract shallow or superficial incisions. Used to retract shallow or superficial incisions, and it has two blades which are parallel to each other and right angle to the shaft handle. This is Meyerding retractor. Handle is curved one, and the blade is at 90 degrees to the handle, and tip of the blade is toothed. Meyerding retractor. Frequently used to hold back the tissues and muscle in spinal and neurosurgical procedures such as laminectomy. Taylor hip retractor. This is the Taylor hip retractor. In which the blade has a pointed tip and 90 degrees to the handle. Langenbach retractor used to retract skin superficial fascia. The handle has a hole, and to decrease the weight of the retractor, and it has serrations on the outer border for firm grip, and blade is at 90 degrees to the handle. This is cat's paw retractor, available in three sizes based on the number of prongs, and used to retract the fine structures, and used in fine surgeries to retract the skin in soft tissues, like in ear surgeries and in face surgeries, hand and micro surgeries. We will use this one. Serenis retractor. It is also the handle in this also fenestrated with blades 90 degrees to each other and but in opposite side. Nerve root retractors used to retract nerve roots near the disc in laminectomy. Laminectomy in spine surgeries used to retract the nerve roots near the disc in laminectomies. Nerve root retractors have a crooked design so they can be placed deep in the wound. Derico nerve root retractor and Casper nerve root retractor. These are the two types. This one is a Casper bayonet nerve root retractor, O'Connell nerve root retractor. Next is Cobb's elevator, used to most commonly used instrument in spine surgeries, used to elevate and push the muscle away from the bone to allow the visualization of the spine. The Cobb elevator has various lengths of handles and sizes of paddles. This is the paddle, and having different sizes of paddles and different sizes of handles. Cobb elevator. Kerrison ronger, used to remove bone from smaller areas of spine. Variable jaw lengths including 1 mm, 2 mm, 3 mm, and 4 and 5 mm, depending upon the length. And two jaw slants, 40 degrees and 90 degrees, available in two types: forward biting and backward biting. See, this is Kerrison ronger, which is the most commonly used ronger in the spine surgeries. Pituitary rongers are used to remove the disc and tissues in the small spaces. Features of these rongers can be used for straight. These can be used for straight or up and down biting. Available in several jaw widths, including 2 mm, 3 mm, and 4 mm. Proper length of shaft to accommodate spinal procedures. They are the pituitary rongers. 40 degrees angled forward jaw, and down picture is 40 degrees angled backward jaw. Casper toothed disc ronger, serrated or toothed jaws to help remove the disc and tissue. Nerve hooks used to explore areas around the delicate nerves, and three main nerve hooks are Dandy blunt nerve hook, Cushing Gasserian blunt nerve hook, and Very black nerve hook. You need not remember the names of these instruments. See, just you try to identify the instrument, and this is the first picture shows a Dandy blunt nerve hook. Second one is Cushing Gasserian blunt nerve hook. See, when you see this type of instrument, you should just uh, tell, identify the instrument and tell the name of the instrument as a nerve hook used to retract the nerves, explore areas around the delicate nerves. Dissectors and elevators. See, it is similar to the nerve hook only, but the tips are of flat, the blades are of flat and curved. One side is McDonald's elevator or dissector has one blade has straight tip, and other side is blunt one. Bone curette, it is used to scrape away and remove fibrous tissue and other debris from the bone. It may also be used to scrape and remove small portions of the bone itself. So this one is Walkman double-ended curette, spinal curettes, osteotomy and chisels and gogs. This one already we have covered in last class. What is the difference between osteotomy and chisel? Osteo- Osteotomy, the tip of the blade is flat and beveled on both sides, and chisel is beveled on one side. This one is a Kapner lamina gog to remove the lamina and bone graft, harvest the bone graft. This is mallet having a handle, wooden handle, and a connecting rod with cylindrical heavy metal with flat ends on both sides. This is the lamina spreader, used for widening the space between the lamina to hold the disc spaces open. Pedicle awl to perforate outer cortex of the pedicle. Pedicle probe, used to sound the pedicle for any cortical breach in all four quadrants. They are also used to confirm whether there is any penetration to vertebral body anteriorly during the pedicle screw fixation. Periostal elevator. Periosteal elevators are mainly used to lift full thickness soft tissue flaps. This is periosteal elevator, Freer type. And another type we have most commonly used one is Farabius periosteal elevator. This one. See, we have already seen these instruments in the last class. Once we go through quickly, this one is McDonald's periosteal elevator, already seen, and this one is bone cutter and bone nibbler, used to reshape the bone during osteotomies and amputations. This one is skin hook. Uh, One side is curved one with cat's paw type, and another side is right angle blade. And are the proper instruments, these are the general instruments, and other instruments which is say use exclusively in orthopedics, we have covered those in last class. Once we go through those quickly, revise them. Pins and nails. Pins and nails are of two types. One is circular in cross section, another one is square in cross section. Circular in cross section we will see in the Steinman pin. Steinman pin we can recognize by the pin is round in cross section, circular in cross section with a trocar tip, and there are no threads in the middle or at the tip, and the proximal end of the pin is flat quadrangular. Skeletal traction. These are used for, these pins are used for skeletal traction and for compression arthrodesis along with compression arthrodesis. These are used along with Chanlis compression clamps, arthrodesis clamps. And in skeletal traction, these Steinmans are used along with bolus stirrer. Okay. For skeletal traction in pediatric patients, we will use K wires. This is Denham pin. See, Steinman pin, no threads, and Denham middle threads are there. These are used for skeletal traction in osteoporotic bone and to prevent the slippage and in old people. Shange pin thread at the ends. Shange pin. Uh, in Shange pin there will be threads at the end. These are the threads at the end. Used along with external fixator. This is the Harrington's rod and used blent with threads at one end, but each is far apart. See, used for spine fracture fixation and for correction of scoliosis. They are the blunt with threads at one end, but each is far apart. This is rush nail, which we identify by seeing this hook. Hook is for extraction, and the tip is beveled on one side for easy insertion. Indications are fracture humerus, fibula, most commonly used for these fractures, and previously we used for ulna and radius fractures also. And the disadvantage is no rotational stability due to cross section, circular cross section, and there is no interlocking mechanism. Square cross section, we will see the ulnar square intramedullary nail. See the tip is trocar type, and the other end is threaded for easy gripping and extraction. This is radius square nail, which we differentiate it from the ulnar square nail by the tip. The tip is R shaped or tongue shaped. See this picture, R shape for radius and R shape for radius, and the tip it is tongue shaped and beveled for easy insertion and prevents the penetration of the far cortex. Square nail is also known as Talwalker's nail. Talwalker's. This is a radius square nail. This is Kunzer's clover leaf intramedullary nail, in which the cross section is of clover leaf type, and it has a slot on one side and eye or fenestration on the other side, which is used for identifying the direction of the nail in CM on X-rays or radiographs. And for this eye is also used for extraction of the nail, and it is blunt hollow with cloverleaf cross section. This blunt hollow maintains the medullary continuity throughout the bone, and this cloverleaf shape is used to prevent rotation to a certain extent. And this slot should be most commonly used for femur fractures, also can be used for tibia fractures also. And femur fractures, uh, this slot should be in the posterolateral type side, and this is medial side, anteromedial side, which is on the compressal side of the bone. See, it works on the principle of 3 point fixation. One is at the upper level at the entry site, and another one is narrowest part of the bone at the isthmus, and third one is condylar, buried in the condylar cancellous bed. Indication is fracture shaft of femur and humerus tibia, ideally in a young patient with the fracture at the junction of upper and middle one third, no comminution, transverse or short oblique fracture. See, it has two eyes for removal on the posteromedial part of the femur. This is posteromedial, and this slot occupies the anterolateral side. This can be introduced by two methods: open method and closure method, antegrade and retrograde. This is interlocking intramedullary nail. This one is. See the interlocking nail, and which is fixed with the two interlocking bolts to prevent the rotation of the nail within the medullary canal. And this one is interlocking nail, and this one is long proximal femoral nail, long PFN, we'll call it as. And V nail, which is cross section is V shaped and used for fracture tibia, and it has a gutter on the posterior side, and it has a bend. See, we have to identify this nail by seeing the cross section and bend. Herzog's bend. Herzog's bend is 11 degrees. 11 degrees for V nail, and used for fracture tibia, and it has a gutter on the posterior side used to pack the antibiotic coated cement on the posterior aspect. See, this is the antibiotic coated cement duff, which we pack it on the in the groove of the K nail or V nail and insert in the medullary canal. This is more spin used for fracture neck of femur in children, and uh, other screws may cause the disruption of the growth plate. And it has threaded portion and plain portion with two knob-like structures. More spin used for fracture neck of femur fixation in pediatric patients. Screws we have already discussed: cortical screws, cancellous screws. This is processes, Austin-Moore processes. It has four parts: head, neck, collar, and stem. And stem has two fenestrations for detecting the direction in X-ray and for inserting the bone graft. And the collar has an eye for removal while removing the prosthesis. And this part is shoulder, we'll call it as, which will be beside the medial aspect of greater trochanter. Indication is intracapsular fracture neck of femur, transcervical and subcapital fracture with a little bit of intact neck. Basal fracture, this is Thomson process, which you will identify by seeing the shape of the stem and by seeing the cross section of the stem, and it has no fenestrations. And for osteomer process, there will be at least 1 centimeter of 1 or 1.5 centimeters of calcar or neck should be present. If the calcar or remnant neck is less than 1 centimeter, then we will use Thomson prosthesis, which will be fixed with bone cement. Bipolar prosthesis. See, this is bipolar prosthesis. It has two heads, outer head and inner head, separated by polyethylene liner, and the movement occurs at two sides between the acetabulum and outer head and inner head. And as the movement occurs at the two sides, the range of movement is more for bipolar processes than osteomer processes. But this movement will decrease after few months, after 3 to 4 months, and it will act as unipolar prosthesis later on. Complications, complications are bipolar processes are mostly used for young patients in hemiarthroplasty or total arthroplasty cases, and where the in bipolar process the neck length is fixed one. And complications are sciatic nerve injury, loosening, and infection. Again, we have seen the chisel and osteotomy. Use it to chip the bone. Chisel is to chip the bone, and osteotomy is to divide the bone. This is Farabiov's periostal elevator. This is the thumb rest, and it has serration to prevent the slippage of the thumb. And this is the beveled edge, curved one. Curved. The tip is curved and beveled. Bowler stirrup used for skeletal traction. So this is upper tibial pin traction. This picture shows, and it has a loop for which the nylon cord tied here, and bowler stirrup and screw securing the Steinman pin. Thomas splint, metal oval ring, 2-inch angulation at outer bar and side bars. This is distal W. See here, 2 inch means 5 centimeters. There is an angulation at 5 centimeters from the proximal end, and this ring metal oval ring is at 120 degrees with the inner bar, and this W side end it should be 6 inches, 6 inches beyond the sole heel of the foot. Thomas knee bed splint, most commonly asked, kept in exam, and this is the Thomas splint, initially devised by Hugh Owen Thomas, used initially for immobilization of tuberculosis of knee, but now it is used for fracture shaft of femur during the transportation and for definitive fixation of fracture shaft of femur in pediatric cases. Parts of Thomas splint consist of ring, metal bar, lateral bar. See, use immobilization of lower limb, bowler bronze splint. First, this is BB splint, initially devised by Braun with single pulley consisting of one pulley, later modified by Bowler with three pulleys. This is pulley A for lower tibial pin traction and for calcaneal traction. This one is, and B is for upper tibial pin traction or distal femoral pin traction, and C is for to prevent the deformity and changing the direction of the traction and to prevent the equinus deformity of the foot. Advantages are multiple tractions can be possible simultaneously, and the angle of traction can be changed without changing the traction arrangements. These are the advantages, and disadvantages not suitable for transportation because of the cumbersome device. This is X-fix clamp. Uh, Here AO rod, which is of 11 size rods, we will use for fixing the uh, pins, fixing the Steinman pins. And here slot will be there. In that slot, we will tighten the Steinman pin with these clamps. This is K wire. They are versatile, very versatile instrument used for small bone fracture fixation and correction of deformity. After correction of deformity like CTEV, congenital vertical talus, we will fix it in used for fixation in corrected position. Stapler to arrest growth of epiphysis on one side and correct genu valgum or varum, used for arthrodesis in osteoarthritis, closed wedge osteotomy. This is the bone nibbler used for smoothing the cut bone end of amputation stump or after removal of exostosis. This is Joshi's external stabilization system retractor, screw for adjusting the distance and comminuted distal radius fracture, CTEV distal tibia fracture. This is Charnley's compression device, which is used along with Steinman pin for arthrodesis. This one you don't need. This is the DHS again, very important uh, implant. This is the DHS plate and this is DHS screw, compression screw. See, in this the holes are staggered for even distribution of stress while loading the fracture site. Okay, alternately it is the holes are staggered so that the stress will be distributed over the bone evenly when the limb is loaded. And this is the screw whose core diameter is 8 and the thread diameter is 12.5 and the barrel diameter, inner diameter of the barrel is 8.2 into which the 8 core diameter screw will fit. Okay, and the barrel, the angle between the barrel and plate is 135 degrees. Most commonly used is 135 degrees and it is available in 130 degrees also. This is dynamic compression plate. By seeing the oval holes over the plate, you can recognize this plate as dynamic compression plate, where we will get compression at the fracture site. So the name is dynamic compression plate by by three methods. That is by eccentric screw fixation, we will get compression at the fracture site. Another one by using Muller's compression device, we will get compression at the fracture site by using this DCP. And another one is by pre-countering the plate. By bending the plate, we will get reduction at the fracture site. This is dynamic condylar plate. Sherman plate. This one is oldest one of the dynamic condylar plate, where we differentiate from DHS by the angle. DHS dynamic hip screw plate, DHS plate is available in two uh, angles, 130 and 135 degrees, and this is available in 95 degrees. Used for fixation of fracture, distal femur condyles, and for fracture, comminuted and reverse oblique fractures of greater trochanter and intertrochanteric fractures. This is Sherman plate, which one is oldest, earliest plate invented, Sherman plate. And this is one-third tubular plate. The tubular plates, these are available in three sizes: one-fourth tubular plate, one-third tubular plate, and semi-tubular plate. Means 1/2 tubular plate. This, the names are because it makes The width of the plate makes one third of the complete circumference of a tube. So the name is one third tubular plate. These are thin and moldable, used for distal ulna and lower tibia fractures and lower fibula fractures. And another type of plates are locking plates. Locking plates are and dynamic compression plate, and other variant is the inner surface. The lower surface has slots so that it decreases the contact over the bone. That is known as low contact dynamic compression plate, LCDCP. This one is DCP, and its variant is newer variant and modification is LCDCP, low contact dynamic compression plate, so that the it preserves the blood supply of the bone. Another type of plate is the locking plate, in which the holes, round holes are of round, and of the holes in the plate are of having threads, which will lock with the threads of the screw head. Those are known as locking plate, LCP. LCP. And other type of is both dynamic and locking holes are can be seen in single plate. Those are combi hold plates. See, now write the names of the plates available. There are of four types of plates. One is a dynamic compression plate, and its variant is low contact dynamic compression plate. And second one is locking compression plate, LCP. And third one is combi hold. Both dynamic and locking holes will be in the same plate. Those are combi hold plates. Then next is tubular plates. Another type of plates are reconstructive plates. Recon plates. They are of the three types of plates, and based on the mode of mechanism of action, those plates are divided into four types again. Buttress type. Buttress means just it gives support to the fracture fragment. It acts like a wall used for fixation of comminuted fractures. Buttress plates. Second one is bridging plate. Bridging, it just bridges and it holds, and it does not hold the comminuted fragments. It holds the proximal and distal and major fragments of the bone, and it just bridges the comminuted fragments in between. That is known as bridging type. Third one is compression type, which provides compression at the fracture site. Compression type. Fourth one is neutralization type. For neutralization plates, we will use a lag screw along with the plate. Ba- Based on the mechanism of action, there are four types of plates: neutralization plate, bridging plate, buttressing type, and another one is compression type. Four types of plates in orthopedics. Thank you.